Differential diagnosis. The first condition in our differential diagnosis is the subarachnoid hemorrhage. And a differential diagnosis is just a list of other conditions that could explain a patient's symptoms. So when it comes to subarachnoid hemorrhage, it refers to bleeding into the subarachnoid space. That is the area between the brain and the tissue that covers it. I did post a picture kind of where that's located in the brain and the location in the subarachnoid space. This bleeding is usually caused by a ruptured cerebral aneurysm. According to Herther and McCann's, when a blood vessel begins to leak, the patient may experience symptoms such as headache or changes in mental status. But when the vessel fully ruptures, it can cause a sudden, severe, or what's called an explosive headache, and it's often accompanied by nausea and vomiting. Subarachnoid hemorrhage can resemble meningitis in many ways. Some overlapping symptoms are going to be the sudden onset headache, neck stiffness, and photophobia. How is it ruled out? It's ruled out by a non-contrast CT scan. That is the initial diagnostic tool. But CT scan, the imaging it's highly sensitive for detecting the blood in that subarachnoid space during the early hours after a bleed. But as the red blood cells begin to break down, it can become a lot harder to detect on imaging over time. So that's why it's so important to have an early diagnosis for it.